My name is Quint Studer. I'm the founder of the Studer Group. And every quarter, we give out a healthcare organization of the month that's outside the United States. Like all awards that we present each month and each quarter, we're very picky about it because we think, one, it's our credibility, and like you, we have a value system. And if somehow the organization we would select would not be deserving for any reason, one, it would hurt our credibility, because when we put you on our website, everybody looks and says, wow, they're doing it. Let's go find out how. So we're very, very picky. We've had organizations win a lot of prestigious awards, well-deserved, that have never been named our Healthcare Organization of the Quarter. So it's real exciting, because in the 13 years or so that I've been doing this, I don't think I felt better about an organization winning our Healthcare Organization of the Quarter internationally than I do today with St. Andrew's War Memorial Hospital in Queensland, Australia. So congratulations. We're just thrilled. And we're thrilled because when I was reading Reason You Won It, I kept saying, wow, that's a place I'd like to go to. And you know, you do it in so many locations, and we know how hard it is to scale. And the fact that your outreach is so intense in Australia, and the fact that you're able to take that quality and drive it, is really impressive. The other thing I'm very impressed with about you is you don't just say, let's do it everywhere. You pick some spots to pilot it. And you pilot it, you figure out what's the best way for it to work for you, and then you scale it throughout the organization. By doing that, you've already proven that it is successful, so people can't use the excuse, it can't happen here. Now, I love your values, certainly compassion, respect, justice, working together, and leading through learning. And when we think of those, we really think about things like employee engagement, a great place for a physician to practice medicine, a great place for a leader to lead with the training that a leader needs to work in tough environments today, and also for patients to get care, and certainly families to be involved, and the key of your volunteers in carrying out your values. Now, our mission statement fits with what you try to do very well, and we want to create great places for employees to work, physicians to practice medicine, and patients and family to receive care. So thank you, because the only way we can fulfill our mission statement is by having other organizations allow us to work with them in their organization. We love the fact that you call living the values, which we call evidence-based leadership. But I love the term when you pilot the site of Uniting Healthcare called Living Values, because I think that's really what it's all about. In fact, more and more I tell people that when you do certain things, it's really about not evidence-based leadership, but value-based leadership. What do I mean by that? Well, if you see a better way to do something, whether it's hand washing, whether it's falls, whether it's reducing turnover, and when you see that and you learn a better way or a best practice or a better practice, if you have values, you can almost not do it. You get uncomfortable knowing there's a better way to do that. And that's really what it is. We always say values are caught much more than taught. You're the first healthcare group in Australia to achieve a full ISO 9001 certification in the last 12 months. And we really love the fact that you really feel that the Living Values program and our partnership will help you accomplish that. We know that the improvements you made on compliance with the staff safety bundle, the hand hygiene, through increasing manager accountability, and the focus being the monthly accountable meeting model, or what we call the MAM. The compliance with it sits at 97%. And it's real interesting because we go in organizations that have had breakthrough results. We'll ask them, what's like the one or two things that you feel you have done? It's not unusual for them to talk about consistently building in monthly accountability in those leadership meetings. How about hourly rounding? You've been doing this for 12 months, and what I love about what you've seen is you're looking at it as not a task, but it's a living value. And a living value is a life-saving practice. A story here in the States was, we had a nurse who wrote a note to her manager, and it was forwarded to us, and she said when she first heard about hourly rounding, she said, oh my gosh, one more thing to do. And she treated it as a task. Then one day she went into a room, and she realized that when she went into that room, that the person wouldn't have hit the call bell because they were having a stroke. And the fact that she'd gone into the room helped to get a much better clinical outcome from that patient. And what she wrote was, she used to think it was a task. Now she sees it as a life-saving practice. So that's quite amazing. of how many times you've done this over the first 12 weeks of implementation, and you've seen the results of falls reduced more than 35%. Now, being in a hospital and being a hospital leader for many, many years, I know how it feels when a patient falls. I know exactly what happens because the family would run down to my office to complain because they went into the room and grandma or mom was laying on the floor. They had to bring her down to radiology, see if she had had a fracture of the hip or the back. The family was a nervous wreck the whole rest of the time, and they just assumed that we weren't providing the care that we could provide. So the fact that you're doing it and seeing it as a life-saving practice, which reduces falls, but also what I call it becomes proactive care instead of reactive care. See, when call bells were invented, they were really invented as an emergency response system. So the person could hit the call bell in an emergency situation. But over the years, they didn't become the response mechanism. They almost became, that's when we go in the room and they hit the call bell. So the fact that you're doing this, you'll know, our research shows that your call bells will go down almost 38%. And by doing that, now you can be more proactive in your care and achieve living the value with better clinical outcomes. And talk about patient experience. Your target is 90. And if you look at what you've done, you've been you've been over 95 for now over a year, almost 2 years, and you've actually hit 96 3 different times. So that's really amazing. And when we say patient experience, it's so much more than satisfaction. It means that the communication from the doctor and nurses there and the support staff. It means it's clean. It means it's quiet. It means our pain's being managed. It means patient understands their discharge instructions. And we understand the side effects of medication. As you know, you're managing pain. So it's really building that clinical confidence with the patient that we're getting good care or even great care. Your hand hygiene is improved from the 74th percent to the 80th percent, with your industry average being the 73rd percent. Your turnover, and I really want to talk about this for a few minutes, has gone down to 7.29, down from 13.6. Now, let me give you some statistics. According to the Voluntary Hospital Association, or we call the VHA, who's done a lot of research on this, they took turnover and they correlated it to mortality. And what they found is organizations that had turnover of more than 12% had higher mortality. That means people that should have lived or should have died. If you look at mortality rating, what we find is it's saying people that should live, live. People that die probably will die. But if your mortality rating goes really down the way we look at it, that means that certain people, that all the people that should live are living, and even some people we thought wouldn't live are living. And you've done it. You've gone below that, what they call that threshold of 12%. In fact, you've gone to 7.29%, which means better staff employee engagement. Now, another university study showed there's direct correlation between employee engagement and patient safety. There's a direct correlation between employee engagement and patient flow, process improvement, and so on. So when you think about your turnover, not only did you lower turnover, but you raised clinical quality, and that's why you exist. So let me tell you what comes next. You will be getting this crystal flame, which represents really, in early 1995, when I spoke at a conference, somebody called me a fire starter. Now, I wonder what that meant, and they went on to say that that meant somebody who carries a flame. And with the external winds blowing and healthcare being dang tough in Australia, we know that sometimes it's easy to let our flame or our pilot light get a little low. But what we find is you got to, one, take responsibility for turning your own pilot light up, and then when your flame is high, you can help others. So you're really leading an example in Australia by showing how it can be done. You know, it's not surprising, because what I find, people call me up and they'll say, "Quint, do you help organizations in turnaround?" I said, sometimes, but mostly we work with organizations that are already pretty good, but their values keep talking to them and sending that message, but we can even be better. And that's certainly what you've done. So you'll get this flame. You will get a number of a toolkit to publicize this in Australia, to let people know that you're being recognized throughout the world as a high-quality organization. We certainly hope some of you will become over to our national conference here in the fall, because we will recognize you once again in front of everybody, over 1,500 people, as being our Healthcare Organization of the Month. So on behalf of everyone here at the Studer Group, thank you for allowing us to be part of your organization. And thank you for setting an example, not only in Australia, but around the world, on what really living the values is all about. Thank you and congratulations.